Assalamu alaikum. So as we are continuously uploading series of examinations of orthopedic, today we are going to examine a case of spine problem. So I am going to upload a couple of videos of spine including scoliosis, kyphosis and about the disc bulge, spinal stenosis or disc degeneration causing any kind of compression at the level. So first of all we are going to examine this case. This is a case we will assume that the patient has disc bulge at a specific level in lumbar. Most likely we have the disc bulges at lumbosacral spine, so we will assume that the patient has disc bulge at lumbosacral spine. So I will tell you what the examiner needs to know, to see that the candidate is able to identify what is the level of the lesion and to perform the special tests. So I am going to do, first of all I would like to tell that in surviving orthopedics, the book that we have written on clinical examination, there is a chapter of examination of the spine. So I have given it in tabulated form and in form of points, what point you have to perform. So first I will brief you this examination, I will brief you step by step. In inspection what we can have, and in palpation, in movements and in special tests. So as we all know that spine examination in CPSP exam, in a university exam, it's mainly a long case. You will not have it as a short case. So on history taking I will give another class how to take the history of spine. So we will keep this spine examination focus on spinal stenosis, lumbar disc prolapse or any kind of compression. Cauda equina can also be the candidate in this examination. So as it's a long case, you don't have to do running commentary. You just have to observe and make your findings note. So how we will approach it? We have taken the history. History has told you that the patient has this differential diagnosis. Now we are going to examine on inspection, as I have told you in hip examination that there are few steps, same will be followed in spine. Unless patient has some problem in gait, then there are specific signs. These three videos of spine, thoracolumbar spine scoliosis, kyphosis and disc prolapse, these may not need to perform some special test, as in cervical myelopathy I will upload that video as well. So first of all you will ask, we have taken the history, we are assuming we have taken the consent, we have interacted with the patient, now we are going to examine. We will ask the patient to please stand up. आप खड़े हो जाएंगे यहाँ पे, आप बिल्कुल सीधे खड़े हो जाएं, बिल्कुल सीधे खड़े हो जाएं. So first of all what you need to examine in the patient, you have to examine start from the head and then going to the shoulder symmetry and then going to any kind of abnormality, then anterior superior iliac spine levels, any wasting of the thigh, any wasting of the calf muscles, and then comment on the foot, because below this is T12 dermatome and then you have L1, L2, 3, 4, 5, S1, I will tell you in detail. So you have to see the finding. In disc prolapse patient, the possible findings are that the hip may be in flexion, knee may be in flexion and he may not be able to stand comfortably. So he may assume a posture of like this. As you can see, he is standing like this. So now you will ask the patient to look forward, बस आप खड़े रहें यहाँ पे, and you will see the levels. You will comment on the cervical spine, spine symmetry, then you will comment on hip is in extension or flexion, knee is in extension or flexion, both legs दोनों इकट्ठी रखें टांगे, शाबाश. Then from the back, now I am coming on the back. On the back it will tell me anything, any scoliosis, any deformity, any kind of abnormality of the spine. You will see shoulder, spine, scapular symmetry, then spine, then anterior superior iliac spine levels, then again the muscles wasting any kind of asymmetry, calf muscle, popliteal fullness, and then heels physiological valgus or not. So among the positive findings, there can be difficulty in standing and the patient posture on the hip and the knee. So once you have examined, then you will ask the patient to walk. आप थोड़ा सा चल के मुझे दिखाएं, चल के दिखाएं. You will notice the चलते जाएं और वापस आ जाएं. You will note the swing and stance phase of the patient. चलते जाएं जल्दी, and ask the patient to have a brisk walk at least, not slowly. So the brisk walk gives you more finding despite asking him to walk slowly. थोड़ा सा पीछे हो जाएं, बस ऐसे सामने देखें. So I have done inspection front, side, back. I have asked him to walk. Then there is the next thing is sit and squat, stand on toes and stand on heel. In spine examination, when I am asking to नीचे बैठ के उठ सकते हैं, नीचे बैठ के उठ सकते हैं, उठ जाएं, शाबाश. So basically in sit and squat you are checking the hip joint, you are checking the knee joint movement. Apart from this, you have also checked the myotomes as well. Hip flexion, L2, knee extension, L3 you have checked, and then you have checked for ankles, dorsiflexion and plantar flexion. You will ask him, अपने उंगलियों पे इस तरह खड़े हो सकते हैं? Yes. The next command is this. फिर अपनी एड़ी पे खड़े हो सकते हैं? You have checked the levels L4 and S1. L5 is extensor hallucis longus. We will check when we will ask the patient to lie. Now there is another thing. You can ask him to walk on heels and walk on toes. And another thing in gait, when you see any kind of asymmetry, you may ask to walk on the straight line. So here we have done our inspection, front, side, back, gait, sit and squat, stand on toes, stand on heels. What findings it can give us? It can give us a specific level of lumbar disc herniation. In my book, I have written the dermatome, myotome according to ASIA scoring. In the examination, we will more clarify these things. So if he has a disc prolapse at the level of L4, then the ankle dorsiflexion, if on the unilateral, he will have difficulty on standing on the heels. So if he has a foot drop, you will also pick at the same spot. So these steps are very important. Inspection, front, side, back, gait, sit and squat, toes, heels. You are memorizing these steps, but you must know what these steps are giving you, and then sit and squat. So sit and squat gave you the information about whether the patient has any kind of difficulty in both the joints and at different myotome levels. So there are some different measurements now. If this is a case of scoliosis and kyphosis, there are 6 to 7 measurements that I have mentioned in my book as well. Inspection you have done, now there are some measurements. You will ask him, he is standing like this. You may do in another sequence, but I would prefer that before asking him to sit, you must perform all this. You will say, आप आगे झुक सकते हैं, आगे झुक के नीचे हाथ लगा सकते हैं, बस ठीक है, खड़े हो जाएं. If he is able to do, then you have no need to go for Schober test, wall test, because we also may have the case of ankylosing spondylitis. So as you have seen, he is able to lean forward. आगे झुकें. So if he is unable to lean forward, then what will you do? You will do the Schober test. And how to perform the Schober test? I will ask him to look that side so that you can see. उधर देखिएगा, शाबाश. थोड़ा सा आगे झुक जाएं. You will first identify the most prominent part of the iliac crest, and then you will draw an imaginary line. You can point here, and then you can, at a specific measurement, you can point the other one at the 10 centimeters or 5 centimeters. So you have marked the other one. Let's do it at 6-7 centimeters. जी, अब आप आगे सीधे, बिल्कुल सीधे. When you are marking this, the patient must be इरेक्ट 5 सेंटीमीटर। नाउ आगे झुक जाएं, बिल्कुल आगे झुक जाएं, पूरा झुक जाएं। सो यू कैन सी दैट ही हैज़, बिल्कुल ठीक है, खड़े हो जाएं। सो ही हैज़ नॉर्मल शोल्डर टेस्ट, द एक्सकर्शन इज नॉर्मल। So now you have performed the shoulder test. Now no need to perform the wall test, and one thing that is before asking him to sit is the Trendelenburg test. I have told in my book as well that Trendelenburg test, CPSP examiners, MS examiners, they prefer to do it from the posterior aspect. You can do it anteriorly, but from posterior aspect it's more relevant. From posterior, what you have to see? You have to see the sagging of this point of iliac crest, the gluteal fold sagging. But for gluteal fold sagging, the underwear must be more narrower than this one. Now you will ask, you will see at the level of the patient. आप थोड़ा सा इधर देख लें, उधर सामने देख लें. At the level of the patient, I am pointing both the highest points and I am asking the patient, आपने ये टांग उठानी है, ठीक है, ऐसे, ये देखें, ऐसे उठानी है आपने, ऐसे, बिल्कुल ऐसे, आगे को नहीं करनी. अवॉइड फ्लेक्सिंग द हिप, आस्क हिम टू डू लाइक दिस, ठीक है, ऐसे खड़े हो सकते हैं, गिरने लगे तो मुझे बता देना. देन बस ठीक है, ऐसे ही दूसरी साइड पे खड़े हों. कीप अ डिस्टेंस फ्रॉम द पेशेंट सो दैट देयर इज नो एनी miscoordination. Okay, thank you. So the Trendelenburg test is negative, there is no sagging on any side. Now you have performed it. If it would have been the case of scoliosis or kyphosis, I will tell you in next videos, there are different measurements: Plumline, rib arm trunk distance, rib crest distance, and there is another angle, rib hump angle. So in the case of disc, if you see visible scoliosis or kyphosis, then you can perform the Plumline test. Plumline test, to perform the Plumline test, what to do and what to, I have the Plumline over there, can you give it to me? So in Plumline test, you can see कि आपने how you are going to perform it. So see, you will see the levels. You will see the levels like this, starting from his cervical spine, and in thoracic scoliosis or kyphosis, you will give your findings like that the plumb line is not going straight to the natal cleft, or you will say that the apex of the deformity is to the right or left side. It is not appropriate, or I can say it is not good to say convex curve, concave curve on the right or left side, because in exam the pressure is so much that you can have a mistake. So so you must say the apex of deformity is on the right side or the left side. So till now we have done in inspection and our measurements. The possible findings could be, there may be antalgic gait, there can be spastic gait, there can be difficulty in standing, posture of hip and knee, and there can be Schober test positive. Remember, in this case the Schober test may be positive because of severe pain and muscle spasm. Then you will perform the test for ankylosing spondylitis, the wall test. Then the other thing, you have performed the Trendelenburg test, and you have asked him to sit and squat, and you have asked him to stand on toes and heels. So it has given you enough information. Now you will ask him to sit down. Ab baith jaye. So there is not much in spine while the patient is sitting. I would say that while you are doing the palpation in sitting posture, you must be at the back of the patient. So I will go at the back. I hope we have enough wire. So you will check the temperature like this over the affected part. Now the palpation, and then you must be seeing the patient, right? You can do it on the right or left side while you are posteriorly using your dominant hand. Then you will go for deep palpation, and all the spinous processes, facet joints, these must be palpated. I think the camera is appropriate over there. So you will palpate it. Temperature, tenderness you have done. Now the next step, as you know, we have about pulsation, but it's not possible. We have to do the pulsation. We will do by asking the patient to lie supine. Now the next step, that is the most important step, and the examiner wants you to know about it, is to check the dermatomes and then the myotomes. So I would say, if the pathology is in the thoracolumbar spine, you have asked in history and all that, then you can do and perform from below T4 level, or starting from the T4, the nipple level. You will ask, you will check the sensation. So sensation checking, as you know, ये देखें आपको एक जैसा महसूस हो रहा है, आंखें बंद कर लें, एक जैसा महसूस हो रहा है. So T4 एक जैसा महसूस हो रहा है, ठीक है. So at the umbilicus level T10, and then you will ask him, एक जैसा महसूस हो रहा है, L1, L2, L3 at the patella, L4, L5 and S1 at the lateral borders. So S1, L4, L4, L5 and S1. So as per the dermatomes mentioned in the book, you have checked the dermatomes. Now what myotomes I can check while the patient is sitting? I would say check the hip flexors and knee extensor while he is sitting, and the rest of the things by making him to lie. इसको ऊपर उठाएं, ऐसे नहीं, इसको ऊपर उठाएं, ऊपर उठाएं जोर से, इसको ऊपर ढीला छोड़ दें, ढीला, इसको ऊपर उठाएं. So I have जोर से check the L2. If the pathology is at L2, 3 level, there will be weakness. सीधा करें, so सीधा करें जोर से. Extension at the knee, L3. सीधा करें, L3. Now we are left with L4, 5, S1. You know L4 is ankle dorsiflexion, extensor hallucis longus is L5 and plantar flexion is S1. We are left with that. So there are two possibilities. If you are suspecting that the pathology is above thoracic spine, which is less likely, then I would say the dermatome and myotome must involve the upper limb, preferably from C5. In cervical spine videos, I will tell you the checking of C5, 6, 7, 8, T1, T2. Right now we have checked from T4 up to S1. So now I'll ask the patient to lie supine. And before, one thing that I have skipped, you must check the movements of the spine before asking him to lie supine. खड़े होइएगा, आप आगे झुक के दिखाएं, झुक सकते हैं, so बस ठीक है. Then asking him to, ऐसे पीछे को जा सकते हैं, बेंड हो सकते हैं, बस 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 बस. Supine, forward flexion, extension. Then you ask him to place both hands on his iliac crest. दोनों हाथ यहाँ पे रखें, ऐसे. नीचे वाला धड़ घूमने नहीं देना और ऊपर वाले को घुमाना. शाबाश, ठीक है. ऐसे करें और ऐसे करें. शाबाश. So if he is unable to hold it, you can hold it. अब घूमें, घूमें. शाबाश. अब घूमें दूसरी साइड पे. शाबाश. So rotation at the spine, thoracolumbar spine, is bilaterally comparable. The other thing is lateral flexion on both sides. अब ऐसे इस तरह कर सकते हैं. शाबाश, शाबाश, ज़बरदस्त. दूसरी साइड पे. So the lateral flexion. These are the movements that needed to be screened. Now asking him to lie down. लेट जाएं सर, लेट जाएं, बिल्कुल सीधे लेट जाएं, लेट जाएं. Now I know that my myotomes are left that ankle dorsiflexion, ऊपर को जोर लगाएं, जोर लगाएं, ankle dorsiflexion, जोर लगाएं, and then extensor hallucis longus L5, ये अंगूठा ऊपर को जोर लगाना, ऊपर को. So checking them simultaneously will help you to identify the weakness. अब नीचे को जोर लगाना मेरे हाथ पे, जोर लगाएं, stabilizing the ankle joint and checking it, जोर लगाएं. S1. So I have checked the S1. Most likely if there is a pathology at L5, S1 level, there will be weakness on the respective side. Now you have performed the dermatome, myotome. Examiner is happy that you know how to localize the injury. Now there are some special tests. Among the special tests, now most of the examination is now being performed. This is not a tough examination. You just need to know the levels and how to identify. Now the next test is to perform SLR and the components of the SLR. So SLR, I hope you can see me, otherwise I will go on the that side. So SLR, you will ask, you will lift passively and see at the patient face if he is having pain, and then the other side. So SLR significance, as you all know, there are specific levels. After 30 degree there is significance of SLR for the lumbar disc prolapse. Then if the SLR is positive, as say at 50 degree, then what will you do? You will slightly come back and you will dorsiflex the ankle. While doing all this, you must be seeing at the patient, and if there is exacerbation of pain, then this is Lezique test positive. There is another test, that is bowstring test. So how to perform them? When it is positive at a specific level, now flex the knee joint and with the other hand pressure in the popliteal fossa to the sciatic nerve, and if he has exacerbation of the pain, then it is positive bowstring test. So I have performed SLR first of all, preferably perform SLR first of all, components of the SLR, then Stinchfield test you can perform to rule out the pathology is at the hip or not. Stinchfield test, if the pathology is at hip, then इसके मेरे हाथ पे जोर लगाएं, ऊपर को जोर लगाएं, जोर. This is Stinchfield test. If the pathology is at the hip, then he will have pain. बस छोड़ दें, ऊपर उठाएं, ऊपर उठाएं, उठाएं, जोर लगाएं. If he has pain by this maneuver, this is Stinchfield test, then the pathology is in the hip joint. I have performed two things. One is roll test. This is roll test. Simply grab with both hands and internal external rotate. If the pathology is in the hip joint, we will be able to see the pain of the patient. So Stinchfield and roll test, they are to eliminate the element of your hip pathology. Now you have performed SLR, components, Lezique, bowstring. Coming on to that few last tests. There is Faber, Feder and or Piriformis test. So sometimes in checking the pathology we have to see sacroiliac joint involvement. So I will check the Faber test. To perform the Faber test, you will ask to the patient, इसको बाहर निकालें, टांग को इधर रखें. You will keep your one hand at the knee and contralateral side of the iliac crest, and then push it down and ask the patient if there is pain. Pain will be on the right side. So this is the Faber test. Now the Feder test. To perform the Feder test, there are two ways. One is I have flexed the hip, I am adducting and I am internal rotating. If you can see this movement, this is Feder test or also the Piriformis test. And the other way is to perform it, asking him उधर move करें, उधर move करके लेट दें, उधर move करके लेट दें, and then the patient's leg, इसको नीचे गिराना. Patient's leg is in flexion, adduction and internal rotation. थोड़ा सा इसको अंदर ऐसे ऐसे. So like this ढीला छोड़ दें. So flexion, adduction, internal rotation. If he is have pain, then the Piriformis test is positive. Now what else to perform? I don't think that after this there will be anything else that needed to be performed, but you can ask. आप ज़रा उल्टे लेट दें, उल्टे लेट दें. The two other things that can be performed is, sir, I want to check the sensation at the level of the anal canal, or I want to check the sensation of S2, 3, 4 or anal reflex. ठीक है? So you can ask him that I want to perform the per rectal examination, although it is not needed, but you may need to perform it. The other thing that can be here is femoral nerve stretch test. The only last thing that can be added is femoral nerve stretch test. Although it's not needed in most of the cases, but if needed, you can add femoral nerve stretch test, flexing the knee and then lifting it to extend the hip. If it causes pain, then the femoral nerve stretch test positive. And now the examination is complete. Thank you. आप उठ के बैठ जाएं. At the end, I would like to just give you a revision summary in 2 to 3 minutes. If you are suspecting case of ankylosing spondylitis, lumbar disc prolapse, Cauda equina syndrome, how will you approach? You have taken the history, you will inspect front, side, back, gait, sit and squat, stand on toes, stand on heels, and then you will do Trendelenburg test, Schober test, modified Schober. Schober is positive, go for the wall test and chest expansion for ankylosing spondylitis. If Schober is negative, then you can proceed. Then before asking him to sit or before asking him to lie, you will go for movements at the spine, flexion, extension, lateral flexion and rotation. That's it. Now the patient is sitting. Palpation, temperature, tenderness, and after that you have performed temperature, tenderness, then you will perform the neuromuscular dermatome and myotomes. So dermatomes will start from the T4 going to S1 and in the sitting position L2, L3. Now the patient is supine, you are checking L4, you are checking L5, you are checking S1, the myotomes, and then in the end SLR, component Lazig, bowstring test and Faber-Feder may be needed to perform Shenfield or log roll test, and in the lateral position Piriformis test or supine feather test, and in the prone position asking him to check the PR or the sensation around the S2, 3, 4, and in the end femoral nerve stretch test. So this completes your examination. It will not take more than I think it will not take more than 11 minutes. So you can perform it, you can revise it at the home. I will be uploading the video for scoliosis and kyphosis soon. We are deficient of real patients because of corona issue, that's why we are doing it on the normal patient, but I have tried my best to cover all the steps in the examination. About history and viva, more videos will be uploaded. Thank you so much. I hope the video will serve the purpose.